We will now talk about ethical principles and issues involved in counseling process. Here are our learning projective for the today's session. To understand the importance of ethics, to discuss various ethical pillars of counseling and its process, to acknowledge the ethical importance of confidentiality and its limits, to demonstrate common ethical issues in counseling, to understand the concept of transference and its indicators, to recognize countertransference reactions in the counselors. We'll move to the presentation. We'll say what are the ethical principles in counseling and how it is helping in the process. Working with women facing violence is filled with several ethical dilemmas, and maintaining ethical standards contribute to the welfare of any organization as well as the development of the individual. So when we are working with women who are facing violence, then as professionals, we have a lot of ethical dilemmas, and by maintaining ethical standards, we'll be able to provide the best service for the individual, and the welfare of the organizations will also be taken care of. What does ethical guidelines uh, take us through? It helps us in respecting and recognizing each individual's right to make decision and act according to their beliefs and wishes. This is the principle of autonomy, where we believe that every individual has the right to take their own decisions and to act according to their beliefs and wishes. By following this principle of autonomy, we are respecting the individual's right to take decisions. To form a commitment to benefit the client. This is the principle of beneficence, where you are forming a relationship with the client for the betterment of the client, and we are supposed to provide the service which is for the best of the client, not to harm others intentionally. This is the principle of non-maleficence, where you are not supposed to cause any harm to the client intentionally. uh, then a fair distribution of service within the society, which refers to the justice, where we are supposed to do justice to the client. Ethical principles and counseling helps the counselor to differentiate among being friendly versus being friends, then being with the client and not becoming the client. It also helps to avoid the rescuer role, such as providing sponsorship, lending the money, or assisting the client in childcare, etc. So sometimes when the client comes, we are friendly with the client, but we have to identify if we are just being friendly, or if you are being friends with the client, or if you are being with the client, or if you are becoming the client. So this ethics will help us to differentiate which am I doing, what am I doing, is it the right kind of relationship that I'm having. Also, it will help us to avoid that rescuer role. Sometimes we overcross, or sometimes we cross the boundaries of empathy and we just reach to sympathy, and we really want to do something, but your um laws or your agency policies are not enough, or it is not helping you in providing the best service or in providing what is needed for the clients. Then you as a person uh, go beyond your limits or go beyond your boundaries to help, and there we have that rescuer role, that we really have to help this client. We really have to do something for the client. If the client is from a poor background, we might give some money, or we might offer the client that, it's okay, I can take care of your child for some time. So all these are not professionally required in that context. Now we will talk about ethical dilemmas. So there are different policies uh, for agency, or the laws have different kinds of rules and regulations. We have personal values, and then there is professional ethics. So when there is a client who is coming, and then the client is desperately in need of something, the client's needs uh, have to be met, but we have our boundaries of professional boundaries, we have our personal values. So there is always a conflict between these two, where we don't know if we can do that, but then we really have to do some help for that client also. So that ethical dilemma has to be dealt with. So this ethical dilemma is because we are quite unaware of uh, our role or our ethics as a counselor. So, throughout the session, we will help you to understand the ethical background or the ethical principles by which, as a counselor, you have to work with. So, ethical principles in counseling, where main ethical principles of counseling are beneficence, non-maleficence, autonomy, and justice, which I've mentioned briefly earlier. And then there is integral parts of counseling, which includes confidentiality, being trustworthy, being patient, being genuine, being unconditional, giving unconditional positive regard, and professional responsibility. Each of this we will be seeing in detail. We'll first look into the main ethical principles of counseling. The first principle is of beneficence. It refers to acting to the best interest of the client. So it is providing the service based on adequate training, experience, and supervised practice, and understanding one's limit of competence. So here we are trying to say that whatever the outcome of the session has to be in the best interest of the client, or the conducting the counseling session is for the betterment of the client. So we are supposed to provide the service after taking adequate training, and then we have to have enough and more experience in working in that area. Then your counseling sessions or your case has to be supervised, and we have to be aware of our competence, that we have to know that professionally this is my limitation. And then sometimes you have to upgrade yourself, or sometimes when you are not competent enough, you have to refer the client to somebody else. And then again, providing services to the client whose capacity for autonomy and judgment is diminished because of the pre-existing sensory or intellectual disability. Additionally, those in extreme distress, serious disturbances, or other significant personal constraint. So even though the client is having some problem, like a pre-existing sensory problem or some intellectual disability or some emotional distress, some serious disturbances, or any significant personal constraint where the judgment or autonomy is compromised, then also with the ethical principle of beneficence, you are supposed to provide the service for the best interest of the client only. There are situations where you can see some benefit for yourself, but still, by adhering to this principle, you are bound to do the best for the client and not take advantage of the client because of any difficulty the client is having. We'll move to the principle of autonomy, which is the second one. So the counselor needs to decrease the client's dependency and encourage independent decision making, meaning that the client uh, tends to be dependent on you. The client sometimes would want you to take decision for them, but it is your duty to respect the autonomy of the individual, which means the right of the individual to take decisions, or the ability of the individual to take decisions, and encourage in independent decision making. So respect and acknowledge the client's ability to self-direct. The client is in control and can decide the act as needed for themselves. So it is very much required that we respect the client's ability to take decisions, acting in accordance to client's needs or wishes. So here what we are saying is that the client sometimes, when he or she comes to you, they might want to file a complaint, but the family members might not want it to be done. So when situations like that, as a counselor, you are there to provide the best service to the client, and you are supposed to act according to the client's needs or wishes. If the client is wishing to put up a complaint, then help her to do that. Even if the family says no, even if the family does not want you to do that, even if the family comes and tells you in person, if she's saying things like that, but we can't do. But as a counselor, your ethical principle is to act according to the client's needs or wishes. Then client should not knowingly or unintentionally impose their views on the client. So as individuals, we are all coming from different backgrounds. We all have our own biases, we all have our own judgments, we all have our own perceptions about things. So knowingly or unknowingly, we have to be very careful that we are not imposing any of our personal views or our own personal perspectives on the client. Okay. Respecting the client's right to decline, discontinue, or resume counseling at any point. So it is the counseling service that the client requires. If the client wants it, he will come. If the client is declining the service, or if the client is planning to discontinue or resume, then it is his or her choice, and we have to respect that choice the client has made. The third principle is about the principle of maleficence. Above all, do no harm. That means not causing any harm to the client, avoiding emotional, sexual, financial, or any form of exploitation from the side of the counselor, not providing service when unfit to do so due to illnesses, personal circumstances, or intoxication. So there are times when you are down. As a counselor, you are an individual, you are a human being where you will be going through a lot of emotions. You will be going through, you might be having some illness, you might have some personal circumstances, or you might be under intoxication. So situations like that, you make sure that you are not providing the service because you will not be able to do justice, or you might do some harm to the client unknowingly sometimes. Then again, the fourth principle is of justice, and it says that a counselor should be fair and not discriminate based on caste, class, marital status, sexual orientation, religion, disability, etc., which is very clear by itself that we do not discriminate anybody based on any of their uh, individual factors. Committed to equality of opportunity and services, we have to make sure that every client of us gets equal opportunity and the best service from our side, respecting the human rights and dignity of each individual while providing the counseling service. Then every client is different and not the same solution for every client. Yes, so every client is coming from different background, their environment differs from each other, so the solution for each client is also different, and it has to be tailor made. That is what we are trying to convey here. Fair provision of service being accessible and appropriate to the needs of potential client. So providing the service which is according to the requirement of the client, so which is according to the requirement, which is appropriate to the needs of the client. Now we'll move to the integral components of counseling. First one is confidentiality, which all of us are very aware of. Then respect her privacy and confidentiality. Ensure you protect the woman's privacy. Counselors should not reveal the information about their clients to anyone. Do not discuss her story with anyone unless it is in her interest with her consent. So sometimes when we see some cases, we would want to share about the case to maybe some of our friends or some of our maybe our husband, or to our partner, or maybe to our parents. So we know that this information might not go out from them, but we just want to share. But before sharing, we always have to think: is it needed? Is it necessary? So is it for is am I sharing this information for providing a better service for my client, or just for my ventilation? If you are sharing the information for your ventilation, you can always discuss about it with your supervisor, not with other people. So make sure that if you are disclosing about the client's story with someone else, it is in her interest. It is for providing the better service for the client, and it has to be done with her consent. Storage, sharing, and security. Storing the details, all the informal and formal exchanges, including the WhatsApp messages regarding the appointments or some email messages, all that has to be stored confidentially. When you write reports, your case records, all of it has to be stored confidentially, that nobody else identifies this person. And sharing of information to family members and professionals, and it can be done only with the consent of the client, which I believe we all are doing. Security, the protection of stored information, whether it is in physical or electronic form. So we have to make sure that by no means this person's identity is revealed. Even while you're storing the information, mails or WhatsApp messages, case records, whatever, you have to keep the information, you have to store the information, you have to write it down in a way that the other person does not identify this person's identity, and it has to be stored securely. Maybe if you're keeping it in a locker, or using some password for the documents if you're storing it in electronic form. And you have to make sure that this information that you're sharing with the family members or other professional has to be only with the consent of the client. Disclose any issues related to intimate partner violence or gender based violence only with the woman's consent. You have to take the consent of the woman before you're disclosing any details of IPV or GBV. Help her see the pros and cons of disclosure and take an informed decision. Sometimes the person might not be willing, or sometimes the person might not consent, but you really have to discuss this case with the professional. So you have to tell her about the pros and cons of disclosing this information to the other person and help her to take an informed decision. Use a discretion while disclosing IPV or GBV to other professionals, referral agencies, or even to family members. So this is where you give a filter that the client might have shared you a lot of things, but you need not share all of the story that the client has told you. So when you're talking about, or when you're discussing the case with your supervisor or with a professional, make sure you're giving the information that you need input on, not the entire information. Only the required ones, only the adequate information can be shared. You don't have to share the entire story of the client. Yes, there are situations we can break confidentiality. So, what are those situations? When a client has risk of harming self, where there is suicidal ideations or where there is suicidal behaviors, suicidal thoughts, things like that, we need to break the confidentiality because it can cause a threat to the individual's life. When a client has risk of harming others, so when there is a risk for the individual to harm himself or to harm others, you can break the confidentiality. In case of child abuse or neglect, uh, in case of child sexual abuse, mandatory reporting is required according to the POCSO Act. Uh, and in that circumstances, confidentiality can be uh, ignored, where vulnerable adults are being abused. So when people who are having some amount of disability, okay, when they are being abused and you get to know about it, but sometimes they might not be in a position to give the consent. So there you can break the confidentiality. During court ordered psychological evaluations, if the court is asking you to do some psychological evaluation, confidentiality uh, need not be maintained there for the purpose of involuntary hospitalization. So sometimes the client needs to be hospitalized if the client might not be in a position to consent for it, or if the client might not be willing to take the medical help. In that situations, the client might needs to be taken to the hospital involuntary. During that time, confidentiality need not be maintained. When a client raises the issue of mental condition in legal proceedings, then also confidentiality uh, cannot be maintained. Now, the next principle is being trustworthy or fidelity. A trusting and therapeutic environment is created without deceit and exploitation. Honoring the trust placed in the counselor, restricting any disclosure of confidential information about the client, and transparency in fee structure. So every relationship of the counselor and client is based on some amount of trust. So as a counselor, you are supposed to honor the trust that the client has given to you. You have to restrict the disclosure of the confidential information about the client and the transparency in fee structure. So you have to inform prior that if the service is free, if the service is charging something, and how much is it charging, and each session how much it is. You have to be very clear with the fee structure as well, because it helps in building the trust. And if you increase the charges after some time, or it can hamper the trust and it will affect the relationship. Now the next principle is patience. Patience means having uh, or being able to tolerate the frustration without experiencing extreme negative emotions or exhibiting typical signs of frustration. The client's lack of initiative and reluctance affect the counselor, resulting the counselor giving up on the client. The counselor will take some time to make a positive change. So here what we have to uh, understand is that the client might not give you the results that you were expecting him or her to have. Then you might kind of lose the interest in the client, where the client is lacking some initiative, the client is reluctant to meet the counselor, or the client is showing some kind of dislike towards the therapy sessions. Then you also start to have that reluctance towards the client as well. So we have to understand that the client is going through something and it would need some time for the client to make a positive change. So we have to wait patiently for the client to make some positive change. Genuineness. Counselors genuine care about the client's well-being and understanding why the client has come. And self-awareness, where the client counselor needs to be aware of their strengths and limitations and can communicate their feelings appropriately. So here what we are trying to say is that the counselor need to show genuine concern in client's well-being and to understand why the client is there and what is the help the client needs. And the counselor also needs to be aware of the strength and limitations the counselor has, and then you have to be mindful about what you're lacking, and while you're communicating your feelings you have to make sure that you are not hurting the client, you are being supportive only. Genuineness, again, comfortable with the client. Create a safe environment where they feel comfortable enough to open up and talk. So as a counselor, it is your duty to create an environment for the client where she feels very safe, where she feels comfortable to open up and talk about. And counselors need to make them realize that they have strength regardless of their situation. So if they are undergoing through something very bad, but they have the strength, they are stronger than they believe they are. So the counselor has to reassure the client about the strengths. Unconditional positive regard. So this is a very important principle that we have to keep practicing. So it is about caring, nurturing, and accepting, even when the other person has done some questionable thing. So the client might not have given you the entire picture of what has happened to her, or if the client might have twisted some information. Things like that happen in our practice. So even if the client is doing that, as a counselor, you are bound to provide unconditional positive regard. You are still caring, you are still nurturing, and you're still accepting the client as the person he is. Providing warmth through non-verbal behavior such as smile, tone of voice, and facial expression. So as a counselor, you provide non-verbal, you provide unconditional positive regard, you provide warmth using some nonverbal behaviors also. Then counselor can ask the client to explain why have they behaved in a particular manner rather than condemning the person's actions. The person might have done something, but then you can still ask the client in a very non-judgmental, non-questioning manner, like we have noticed this behavior from your side, or using some quest in a very mild way that the counselor, that the client does not feel that he or she is being questioned. You can always check with the client, why has that behavior happened from your side. Let's just not blame the client for for the behavior that he or she has done, but ask why it is there. Professional responsibility and accurate assessment of a client's situation is essential. Otherwise, the individual may not receive appropriate treatment and use only standardized or reliable tools for authentic results. So, it is a professional responsibility of a counselor to conduct accurate assessment of the client's situation, because the client might not be giving you the entire information. If the client is not giving you the entire information, then the service that you provide will not be complete. Then you will not be able to deliver the appropriate service or appropriate treatment to the client. So it is very much important that the counselor takes an extra interest in understanding where the client is from, what is the circumstances, what is the environment he or she is from, and then to provide treatment, and use only standardized or reliable tools for authentic results. So if you're using some scales to assess burnout, or if you're assessing using a scale for understanding some depression, so make sure you're using standardized scales only, so that the results that you get is authentic. Provide beneficial service to the client within the boundaries of competence. referring the client when necessary. So, as you are a counselor now, and if the client is, if you identify some of depressive symptoms in the client, and you are not in a position to give medication or uh, therapy for the client, so you know that it you cannot do all those things because medicine has to be given by a psychiatrist. Then referral to a psychiatrist is required, and then the client might require some long term intensive therapies like cognitive behavior therapy for depression. So for that, it needs referral where you know that you have not been trained, you have not been experienced in providing CBT to this particular client, and this client needs it. And situations like that, you have to be aware of your limitations and refer the clients to the uh, mm, professionals. Manage personal stress and provide adequate service, which is a challenging thing to do, that we might also be going through something, but we are still supposed to provide um, counseling service or emotional support or uh, other kinds of reassurance to the client where we are also lacking. So, but it is our professional responsibility to manage our personal stress and to provide adequate service to the client. Now we have come to the important part of counseling service, which is the supervision. Then counselors may experience a range of emotions themselves, such as shock, helplessness, grief, anger, etc. It is important to be aware of their vulnerabilities, biases, values, and principles. Ensure that it is in no way interfering with the counseling process, and the counselor may require regular debriefing with the supervisor. So, as counselors, we also have a lot of emotions. We might be in shock, we might feel helpless, we might feel grief, we might feel anger when we listen to the client's story. And it is important that we are also vulnerable, we also have biases, we have values and principles, but ensuring that none of these is affecting the counseling process. So sometimes we might not be able to identify it, so you always discuss cases where you feel some amount of emotional involvement with your supervisor, so that the supervisor will be able to pinpoint if there is some emotional involvement from your side, or if there is some biases that is happening from your side. So it is always better to discuss the cases with the supervisor, so that you will uh, get to know if there is any mistakes that you are doing in the process. Transference and countertransference. This is a very important point to discuss in counseling. So, what is transference? Transference is a client's unrealistic and often inappropriate feelings, thoughts, and behaviors towards a therapist. It is an unconscious displacement of attitudes held originally towards significant persons in the client's life. So, what happens here is sometimes the client might identify the counselor as uh, a mother or a father or sister. They have that kind of dynamics with you. So, the dynamics changes basically. It starts from the client. The client might identify you as a sister or as a brother or as a friend. Hmm? And then they start uh, interacting to you with that dynamic. So this can be good or it can be bad also. There can be good or bad feelings, meaning to say that if the mother is a very critical person and if the client feels that you are being critical, then your uh, relation, the counseling relation is effectively ruined. But if the client is seeing you as a very uh, concerning sister or as a very uh, supportive sister, then again it's a good feeling, but then again it is transparent from the side of client. How will you understand if there is transference happening? So there are some indicators that we'll share now. So the client attitude towards the therapist suddenly changes when there is anger or too friendly or too vague or subdued or unusually talkative behavior that is coming from the client, and that too is suddenly it is happening. Then you can suspect that transference might be happening there. When the client makes remarks like no one understands me and I disappoint anyone or everyone. So these kind of remarks is not supposed to happen in a counseling session, because a counseling session is supposed to make the feel client to make the feel client feel comfortable and understood. So if that purpose is not served there, then we can suspect of transference. The client might not be seeing you as a counselor. The client might be seeing you as a motherly figure or fatherly figure where you are giving advices, and the client does not feel that he or she is being understood. Client comforts therapist with the accusation that I am not getting anything out of the therapy, that you like other clients more. When such statements come from the client, you can suspect transference. Again, there is boredom, angry, stuck, disinterested, distracted feelings from the side of client. We can suspect some transference. Sexual attraction, which is another important area where transference occurs. If there is sexual attraction that is felt by the client towards the counselor, there is transference. There is avoidant or afraid behavior from the client. If the client is not feeling comfortable, if the client is avoiding talking about certain things, or if the client is afraid to share certain things, then you can suspect transference. Not trying to follow effective skills or advice in therapy. Whatever you're trying, whatever you're sharing in the counseling sessions, sometimes the homeworks that you give, sometimes the suggestions that you make, if they are not following, if they are not making an effort also, then you can suspect the transference. Missing appointments, not adhering to timings, if they are not coming on time, if they are missing the appointments, then again there is transference that can be suspected. There are certain factors that increase the transference. There are certain situations where the person is relatively helpless or afraid and who requires protective relationship. And then there you are as a counselor trying to provide support. Then there are these situations can increase the transference. Then there is the client's anxiety about the physical or psychological safety, and then you are providing support, and then you're providing your unconditional positive regards, you're being there, you're telling them that it will be all right. There, the transference is also increased. Then there is a personality factor where there is lesser ability for the client to reflect on their state of mind, feelings, and needs. Now we'll move to countertransference, which is a range of emotion of reactions and responses based on the counselor's past experience and personal issues, including the client's transference reactions. The countertransference is basically what is felt from the counselor's side towards the client, counselor's past experiences or personal issues, or from the client's transference reaction also. So, how do you understand this countertransference? When a therapist redirects their own feelings or desires onto the clients, when you want the client to do this and you're telling the client to do this, that you are redirecting your own desires or wishes onto the client. It occurs when the counselor loses his or her objectivity. So every counseling session has to be based on objectivity, but when the counselor loses that objectivity, when it becomes subjective, there we can suspect countertransference. When there is overwhelmed, angry, or sad feelings when you hear the client's story, there is emotional involvement of the counselor in that case, that will lead to countertransference. It is always suggested to have controlled emotional involvement in uh, providing service to the client. For example, if the client is dealing with issues arising from her sexual abuse experience and the counselor is also an abuse survivor, the counselor might feel that sad, overwhelmed feeling, and then she will take an extra effort in getting justice for this particular woman whom he or she is saying. Then it is quite likely that the client's experience will evoke in the counselors extreme feelings such as rage and shame arising from one's own abuse experiences. These emotions can affect the objectivity and compromise one's capacity to help the client. So when the client is when the counselor is identifying himself or herself with the client, and then it will affect the objectivity, then it becomes subjective, then it affects the overall relationship. It might not satisfy the purpose of the relationship the client has with the counselor. To check for countertransference, the therapist should always examine that if you are identifying with the client, if is sympathy becoming is empathy becoming sympathy, Are you irritated and impatient because of the lack of the progress the client uh, is having? Is the development of a strong liking for or dislike of the client? You might like the client a little too much, you might not like the client that much. So check for all these factors to understand if you're having counter transference.